Dr. Nikhil Balakrishnan for his presentation. He will be presenting effect of amblyopia on macular thickness, microvasculature and RNFL thickness in children.
Good morning, everyone. My topic for today is effect of amblyopia treatment on macular thickness, microvasculature, and retinal nerve fiber layer thickness in children with unilateral anisometropic amblyopia. Now, we all know amblyopia is a reduction of the BCVA of one or both eyes that cannot be attributed to any structural abnormality of the eye, and anisometropic amblyopia is a difference in the BCVA of the two or more lines of acuity between the two eyes. Amblyopia is very rampant, the prevalence of which is as high as 1 to 5% in the world today. And it is the characteristics of it is poor visual acuity, reduced contrast sensitivity, and poor binocular vision. Now, we all know that the management of amblyopia is either with occlusion therapy, penalization, or digital dioptic therapy, which is being used widely nowadays. Published literature already shows us that digital dioptic therapy is very good in the treatment of amblyopia. But our research question for our study was, is there any anatomical changes in the eye which correlate with the effectiveness of the digital dioptic therapy for amblyopia treatment? It was a retrospective study with 90 eyes of unilateral anisometropic amblyopia included in the test group, and their contralateral eyes were included in the control group. Patients were between 6 to 14 years. Unilateral anisometropic amblyopia patients were only taken, and the exclusion criteria have been mentioned here. Once the patient was diagnosed with unilateral anisometropic amblyopia, all patients were made to undergo an OCT for macular thickness, RNFL, and an OCT angio 2. They were then given digital dioptic therapy. We used the Binoc software for 30 minutes daily, 5 times a week for 6 weeks overall. Following this, we did a reassessment of all the parameters to see if there were any improvement. And we also did a reassessment on the OCT and the OCT angio. As a part of the study, we did a manifest and a cycloplegic refraction, a BCVA, stereo acuity was checked by the Randort's test, Wirtz 4-dot test to check fusion, and a slit lamp and a detailed fundus examination. Now, on the OCT, we are checking the macular thickness, the retinal nerve fiber layer thickness, and on the OCT angio, we are checking the superficial and the deep capillary plexus vessel density. Now, we all know Binocs, we use red-green glasses for dissociation, and we do dioptic and fusional vergence exercises during the same. So what were the results of the study? There was no gender bias in the group. Improvement of BCVA, almost 93% of the patients showed an improvement in the best corrected visual acuity, and only six patients out of the 92, that is 6.67%, showed no improvement, which is statistically significant. Improvement in stereopsis. At the start of the study, 74 out of the 92 patients had no stereopsis, whereas at the end of the study, only 13 patients had no stereopsis. So 82% got an improvement of stereopsis with the therapy. Similarly, in cases of fusion, 79 patients out of the 92 did not have fusion before the therapy, and only 11 of them did not have fusion post-therapy. So an 86% improvement was seen, which was statistically significant again. Now, this is where things get interesting. Coming to the macular thickness, we noted that the macular thickness of the amblyopic eye was much higher as compared to the control group. And after giving them 6 weeks of therapy, the macular thickness came down significantly and became almost equivalent as much as the control group, again showing statistical significance. Similar findings were seen in retinal nerve fiber layer thickness, where the thickness was much more in amblyopic eyes and reduced drastically after therapy and came equivalent to the control eye. Now, coming to the retinal nerve fiber layer density, if we see here, the amblyopic eye had lesser superficial and deep capillary plexus density as compared to the control eye, but after successful 6 weeks of therapy, this almost came back to near normal in cases of superficial and almost came back to near normal in cases of deep capillary plexus. Now, the interesting fact, the 6 children who did not improve post-Binocs therapy out of the 92 showed no decrease in the macular thickness, no decrease in the retinal nerve fiber layer thickness, and no increase in the superficial and deep capillary plexus densities. Hence, we conclude that use of digital dioptic therapy helps in improvement of BCVA, stereopsis, fusion, decreases the macular and the retinal nerve fiber layer thickness, as increases the superficial and deep capillary plexus density. So our study demonstrates that anatomical changes in the retina following amblyopia treatment, it's the first to use OCT angio for the same, and demonstrates the correlation of digital dioptic therapy with anatomical changes. How do we translate this to the clinics? If we see no anatomical changes in the retina following digital dioptic therapy in patients whose vision didn't improve, and we routinely perform an OCT and an OCT angio 6 weeks post that, we can stop digital dioptic therapy, as we know that these patients are not going to improve further. The limitations of the study is we can also study other types of amblyopia, and if we can use human cadaveric studies to corroborate the anatomical changes in the retina and the lateral geniculate body. Thank you.
Thank you, Dr. Nikhil. Just a question. I mean, does OCT have a prognostic value? I mean, in terms of if you know the macular thickness before we start dioptic or any amblyopia treatment,
yes, sir,
can we actually predict how much will be the visual?
Yes, sir. So the study says exactly the same thing, that we did OCT pre and post-op. We see that patients whose macular thickness and the retinal nerve fiber layer thickness is decreasing after 6 weeks are the only ones who are going to improve with giving digital dioptic therapy. After 6 weeks, if we see that there is no improvement, that means there is no decrease in the retinal nerve fiber layer thickness and the macular thickness, these children, irrespective of how much further you continue giving them digital dioptic therapy or patching or penalization, are not going to improve further. But these are the patients who are not going to improve. So that's the whole idea of the study, that after 6 weeks, if you're seeing no improvement, there is no point further burdening the patient and continuing giving them binocs or any kind of other therapy, just giving and trying to expect any results. So it gives us a definitive answer that, you know, if they are not improving, then we don't need to continue it. And
was it the same after 1 year or 2 years?
so our study period was only 6 weeks. 6 weeks we did the study, and then we went up to 3 months maximum. We did not go up to 1 year itself, because all published literature shows that within 6 weeks of therapy there is improvement with binocs. Multiple papers have already been published. That is why we kept our study period limited to that itself. So usually usually patients, what happened is after giving the therapy, they usually maintain with it. They usually do not deteriorate. We have continued the study further. We're almost 1.5 years into it. It's not included in this part, but we have seen that patients are remaining sustained with that itself. There's no dip in the thing for the... No, it remains same as the control therapy. We did all the tests at one. None of them increased again. So it remained reduced, almost as similar as the control eye, which was the normal eye, which was seeing well.
So there is no relapse of the...
There's no relapse of this.
Okay.